He now has the power again.
Nope, I wasn't recording. Somebody else was. I think, Steve, you might actually be recording as well, but that's not
let me see here. What? Well, yeah, it must be, because it said that I could pause it if I want to, but I don't know. Of course, it doesn't make any difference who records it, right?
we don't record the meetings, but I am recording this one because Bob can't be here and he would like to see this.
So you could, if he's recording, you could probably stop, Steve. You got it started, Simon?
I do.
All right,
Yeah. We must have this meeting set up so that, and I didn't realize that, Simon, but anybody who wants to could record the meeting. So we should either make a change to that setting, or if we like it, let people know that if it's a speaker they'd like to record.
Oh. And so, Patty, the message here is just watch your mouth. You'll be fine.
Yeah. Yeah. Sometimes easier said than done, right?
I got actually
well, that's
fired.
kind of interesting.
I got fired from a job one time because I misspoke on a radio. Well, not really fired. I was told I shouldn't do this anymore, and they gave me a different job. So
yeah, I had to let someone go because of what they typed into a chat, not realizing that they were sending it to me instead of to the gal across the aisle.
Oh.
It can be dangerous to not be careful of what you say.
Oh, yeah.
Which is why, underscores our rotary four-way test, right?
Yeah. I got sent a text the other day by a woman I serve on another committee with, and she thought she was sending this text to her coworkers. And when I read that text, I thought, oh my God, if I was one of her coworkers, I would not be too happy about that. And I would actually be contacting the supervisor to say, hey, I don't agree with this text. And that was a mistake on her part, and was like LOL when I got back to her and said, well, you texted the wrong person. And I didn't take it hard, but you don't expect to see the word bitches in a text message.
Yep.
And that really threw me off. So yeah.
That's what was in the text message that I got, and it was actually directed to me, and I was her manager. So it's like, believe it or not, there are some people out there who think I am one of those. So.
Oh my, who could? I can't believe that.
I know, I couldn't believe it either.
Guys, dial it down.
In my many years of experience in businesses, women supervising women is a much more rambunctious relationship than it is men over men or men over.
I think it used to be. I think it's changing, Steve. I think it used to be a challenge, but it's as it should. Things are getting better in that front. I think it used to be difficult for women in business in general because they had to be a little more hard line in order to be taken seriously, but I'm not for sure it's the way it is now.
I just found in my working career, I had a lot of women managers, and they did not seem to me to be supportive of the women coworkers, as much as maybe they should have been.
Which is unfortunate.
Good morning, John. We got a lot of guests today.
Ah.
That's the nice thing about Zoom. You can go visit a lot of clubs.
So, Michael, I know you're part of the presentation. John, are you as well?
Hi, I'm with Mike Larson, everyone. I'm Jon Pryor. I'm the president of the East Market of Essentia. So thank you for having us today. It's great to be here.
Wonderful.
Yeah, hopefully we'll get Harlan on here pretty soon. He's kind of the man in charge of the program for the day.
Well, this is our informal period.
This is way too early for Harlan.
I know, right?
Yeah, even Zoom, he's 20 minutes late.
Oh, he'll probably be.
I have to speak nice. Yeah, Good morning, Lynn.
Lynn and Chris and Marcia and Cindy and Mary Kay, Don Peterson, Dave Hardy. We're getting a good group again today. I still say I am really so pleased. Our membership is 23, and typically every week we have 19 to 22 people on this call. So good job. Good job, us.
Stay, Patty, or Simon, the projector that you were using before when we were kind of hybrid, I had to steal it back here for a couple of presentations. So if you're looking for it, holler at me.
Thanks.
It'll probably be a while before we're looking for that again.
Okay.
So
Morning,
Simon,
Rick.
the check for district went out yesterday for the masks.
Very good. Speaking of which, I still have masks. I don't have mine on me. Does anybody have theirs on them? Cindy looks like she does. I still have masks for sale. They are $5.
Oh, I'll get,
Mary Kay, you want some?
yeah, should I send the money? Should I just send, how do you want me to send the money? Just to Cindy or?
Yep, send me an email with how many you want and we'll make arrangements from there.
Okay. Pete, did you finally get that redone?
I did.
I don't get what happened the first time. If it got lost or.
It's all right. We had enough to go forward with the grant.
Okay.
We're gonna have a little grant meeting after the meeting today, right?
Right.
Yeah, 15 to 20 minutes, I think is all it'll take. It's just to take a look at what we need to do with that next request. And
Okay,
there's not a deadline, but I think the sooner we get it submitted, the better. So,
right. I do have another grant request to bring up.
Bob, you're gonna have to pay a fine today.
Well, good morning. What fine am I paying now, Dan?
You were supposed to be at the Bemidji Club this morning.
Actually, I'm doing double duty. I've got two computers going at the same time. So I'm gonna double Zoom. And
Good one.
Good to see you, Dan, and what a pleasant surprise to see Jon Pryor. John, welcome. Great to see you again. It's been ages.
It's great to be here.
This is wonderful. So you're pinch hitting for Pete and for Mike.
Mike and
Mike
I
is
were
on.
I'm here. Mike's here too. Well, there he is. Hey, Mike. Wow.
I drafted Dr. Pryor. He was in town, so I thought you might as well jump on this Rotary call with me.
That is just fantastic. It's been ages since I've seen you. This is terrific, both of you. This is terrific. And I apologize. I am going to have to go on to another meeting with Bemidji Sunrise, but I wanted to say hello to Dan, to Mike, and now to Dr. Pryor. What a treat.
This is great to see you. Thank you so much for welcoming me.
Oh, this is excellent. And I've been told it'll be recorded, so I'll have a chance to listen and hear the wonderful words you have to share. But I trust, Mike, you're going to be talking about the clinic today?
Yeah, we were going to talk about all things COVID and then provide
Excellent.
some Essentia updates as well. I've been working with Harlan.
Great.
And I see Harlan's on. So,
Yeah.
so yeah, we were going to tag team Dr. Pryor and I and talk about some of the things that are going on across the state. And as we were getting introductions earlier on, Dan's going to share how the COVID's going up in Canada.
Great. Well, and as you might know, we've been working with Kathy Sells to work out a pilot program up in the Duluth Superior to figure out the best ways that our Rotary clubs around the entire district can work with Essentia and other systems to get the word out. And so Kathy's been terrific to work with. She's a great resource. And so that we've had a number of meetings with that and anticipate having something, in fact, that'll be part of what Dr. Henry will be speaking on at our district conference. So he'll be speaking at the end of April for our district conference.
Hey, Bob.
Yes.
We just discovered that our Zoom meetings are set up so that anyone who wants to can record it. So Simon is recording the meeting, but if you wanted to record it onto your PC, I think you could just hit the record button.
Wow.
Modern
Excellent.
technology, what a whiz, yeah.
That's marvelous. Well, this is a delight, and all the more reason I regret not being able to stay with the meeting today. It was ironic that the double duty came up. So I wish you well. Have a great meeting. I'm going to zip over to Bemidji, and again, what a pleasure to see you again, Dr. Pryor. It's been ages.
Great to see you. Thank you so much, and thanks for being here this morning.
You bet. Take care, Mike.
I miss you.
Always a pleasure, Mike. And Dan, thanks for coming in.
Likewise. Thanks, Bob.
You all have a great meeting. Take care.
Like Star Trek, now you can actually beam to another meeting.
Right.
Quite. Yeah. Live long and prosper.
I love it. I love it. Well, we'll start at 7:15. We're going to go just a couple more minutes of waiting. See if more people drop in here.
The Just Serve thing for Strive, Steve Hansen approved it and it looks really good. If you want to go to justserve.org, you'd see that. And I created a organization for Central Lakes Rotary Club on Just Serve. I think you can take a peek at that, but it's still in process. It needs a little more finessing with somebody that can do that a little better, finding the right picture, etc.
Very cool.
Sounds like a good job for our public image committee.
I was going to mention that would be perhaps a spot to list our roadside pickups.
It would. Who's on the committee then that who'd like to take on becoming the administrator for that? Is there the committee? Who's on the committee?
Our committee chairs, I think, might be Keith
I remember Keith and Susan. I think you're co-chairs, right?
That's correct.
Okay.
And Stephen, are you still on the committee? Yeah. So
I will send out an email to all of you and on you three, and then we can work through it to see who wants to become administrators on that for just Central Lakes Rotary.
Super Chris, is there going to be service day for Pequot?
Honestly, I don't think we've talked about it.
Yeah.
My guess would be doubtful,
Mm-hmm.
just with all the mixing and busing and stuff that goes on with that. It kind of breaks down some of the things we've tried to keep tight in protocols.
Yeah.
So I'm doubtful, but don't bet on it yet. I'll have to talk to Aaron.
Thank you.
Mm-hmm. Now, that said, it may not hold back us being able to get a group of kids like Interact or something to hop on a bus or in their cars and come over.
True enough.
Keith, are you ready to ring a bell for us?
Yes, I am. Are you ready?
I'm ready. Good. Please join me for the Pledge of Allegiance. I pledge allegiance.
Pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
February is Rotary's World Understanding Month. Rotary was founded on this day 116 years ago in 1905 in the Unity Building in Chicago, Illinois. And this day is now designated World Understanding and Peace Day. May our actions every day, promote unity and peace. Okay, now I need to pick on somebody. Let's see. Bruce, are you up to leading us in the four-way test today?
Sure, I can do that.
Let's do it.
Ladies and gentlemen of Central Lakes Rotary, please join me in the four-way test. The four-way test of the things that we as Rotarians think, say, and do. First,
is it the truth?
Is it the truth?
Second, is it fair to all?
Fair to all concerned.
Third,
will it build goodwill
and better friendships?
And fourth,
will it be beneficial?
Will be beneficial to all concerned.
Thank you.
Thank you, Bruce. I normally say you may be seated, but I think we're good. We have guests today, Dan Brown, Michael Larson, Jon Pryor. Did I miss anybody? Don Peterson's here with us as well. Let's see. Gonna cruise ahead a little bit. We've got kind of a lot to cover today. If your phones aren't muted, please do so. I sent out an email this morning. It's a copy of an email I sent already about the survey. Just take a look at that. Please do the survey. I've only had a couple responses. I'd like a few more. We need volunteer hours for United Way. It's been a weird year. Those need to be in by April 9th. Patty, did you want to say something about that?
Yeah, I will. I can send out an email too later today. It should be pretty straightforward. And as many of us as want to volunteer can. There are a couple of different ways. They have modified the approach this year because of COVID. An example of one of the way we can do volunteer hours is we can reach out to the United Way and send thank you notes on their behalf. One of the other ways is to actually share posts on Facebook and other social media of projects that we're doing, things related, hopefully, to our support from the United Way. So to Strive, if we could get a couple of photos or something like that we could put out there and then thank the United Way for their support. So I will send out information on that, and then we'll be looking for anyone who can volunteer an hour or two, and we should be able to get our required 5 hours fairly easily. So more to come.
Excellent. Thank you. Other things I can talk about, but I'm going to skip them because we've got a lot going on today. So I'm just going to call for general announcements that need to be addressed.
Say, Simon?
Yes, sir.
Since Dan Brown's on our call this morning, I should give a quick update on the Haiti school, because the Nippon Club donated $2,000 towards that construction. And anyway, as you know, because I've been sending out some pictures, the school started in Haiti in first part of January. And as of today, the walls are all constructed on the school. So the next process in the next couple of weeks is to get the roof installed. So as soon as the project is pretty well completed, I'm going to obviously do a report, and I'll be sending that up to the Nippon Club also, so they'll have a record of what was done there. But we really appreciate the Nippon Club participating with us in this project.
Thank you.
Hey, thanks so much.
All right. Now, before I pass the floor to Harlan to introduce our program, I wanted to pass the floor to Dan Brown because he's here in case he wants to share something with us today.
Oh, well, I thought I was going to be at the tail end of the meeting, so you've kind of caught me off guard here. But so actually, I don't know if you know, I have a seat on the district foundation committee. That's one of the things I do in the district now, and I'm also on the grant subcommittee. But just looking, I did some research yesterday on your club, and I noticed your club and my club have a lot of things that are the same. And we're almost like we were both chartered around the same time. You were chartered in 92 and we were chartered in 91. I noticed that your all-time giving is at, as of February 22nd, it was $274,613, whereas ours was $218,661. We have roughly the same amount of members. You're at 23, we're at 19. And I didn't really want to, I know our breakdown between genders, between male and female members are possibly the same. We have 11 ladies in our club and 8 guys. Now, so you're kind of roughly the same. I didn't know when I was counting if Quinn was a man or a woman. So, well, it looks like you're roughly the same ratio. The other thing is the only metric we really beat you on is our major donors. You have 3 major donors and we have 5. Now, mind you, the 5, there's 3 of those are couples and 2 are singles. And just as a matter of fact, I just became a major donor myself just last week, only because I knew by the end of the year I was going to become a major donor, but I partook in a 50-50 draw with the Pennsylvania clubs last week. And it was in support of they have a Gun Doctor Foundation. And so they had an online bingo. I had lousy bingo cards, didn't win anything with that, but I won part of the 50-50. So that allowed me to send in a donation of polio and to the annual fund. And that put me over the top to be a major donor. So that was kind of an exciting thing in my life last week. And I do have to, I really applaud you for having so many Rotary Direct members. You have 12, whereas we only have 1. And looking at the annual fund district progress report, I see you've already raised your or met and surpassed your polio goal. Your goal was 2,000, so you're, as of the 22nd, I think you're at 2305, and you're well on your way to meeting your annual goal of 10,000. You're sitting at 7661. So congratulations on both those. And I think maybe that's all I'll say for today. I don't want to take up any more of your time. I could go on further and give you a bunch of stats for how well the foundation is doing, but I'll let that go for another day. So back to you, Simon.
Thanks, Dan. Thanks for joining us today.
You're welcome.
All right. If there's nothing else, anybody have any other announcements? Hearing none, I will pass the floor to Harlan.
Thank you, Simon. And we're going to dive right into it. I actually have a 3-page bio on each of these guys, Dr. Jon Pryor and Michael Larson, but we'll make it short. Mike Larson is the VP of Operations for Essentia East Market, and the president of Essentia East Market is Dr. Jon Pryor. And I'm going to turn the floor over to them, so we've got max time.
All right, thank you, Harlan. I'll start off again. My name is Mike Larson, Vice President of Operations based here at Essentia Health, St. Joseph's Medical Center here in Brainerd. I moved here about 8 years ago, and it's been a great move. My wife and our kids vacationed up in the Brainerd Lakes area for pretty much our whole lives. We spent 25 years in Red Wing in healthcare down there before moving up here, and it's been a great move to join a good organization and a great community here. I'm going to turn over to Dr. Pryor to introduce himself, and then we'll tag team the presentation.
Thank you so much for having me here today. I'm Jon Pryor. I'm the president of the East Market, which is the western part of Wisconsin, Duluth, and most of north central and northern Minnesota. My background is I'm a urologist by training. I was 17 years at the University of Minnesota. And then I went off the deep end. I got an MBA at Kellogg at Northwestern and decided I needed to do my residency in business. So I quit a wonderful job that I loved. And I did healthcare consulting for McKinsey & Company for 2.5 years. Then I was CEO of a large group practice at Froedtert and Medical College of Wisconsin in Milwaukee for 3.5 years. Then CEO of Hennepin Healthcare in Minneapolis for 6 years. And then for the past 2 years, I've been the president of the East Market. And I have to say, I just love Essentia. I really feel like a healthcare system that can potentially be someday, if not soon, the best healthcare system in rural America. And I think that I love the mission, its purpose, and the fact that it tries to be innovative and really do a better job in delivering healthcare. We don't just rest on how we do today, but how do we make it better and better? And so it's a great organization for me, and I'm happy to be here. So thank you very much.
And I'm going to attempt to share my screen. I saw in the chat, Lynn had put a question out there, best way to connect with me. I will send, I don't know if the best way is to send my contact information back to Harlan to share with the group. Is that the best way to do that? Okay. And otherwise I can share my email certainly to the group if they wanted to jot that down. But I'm going to share my screen. I apologize. I think I heard you refer to yourselves as a Central Lakes Rotary, and I put Brainerd Rotary. So that's my slip up here. I'm going to see if I can get to this, and you'll have to tell me if you are seeing the screen. Is this visible to everybody?
Not yet.
Okay. Did you say not yet?
Yep, we can't see it yet. There's a share screen button at the bottom of your Zoom window.
Okay.
Right next to chat.
Yeah, try it again here.
There it goes.
Is it showing up now?
Yep.
Sure is.
Okay. All right. So in talking with Harlan, I just a time check. We have about 15 minutes. Is that right? Roughly?
A little more than that. We can run up until 8 o'clock.
All right. Well, and I'll keep this informal. Please chime in if there are any questions as we go through this material, and Dr. Pryor and I will take turns at kind of chiming in on some of these slides. But in speaking with Harlan, and by the way, Bob McLean had reached out originally to Dr. Peter Henry, who is our local chief medical officer and also the Essentia System chief medical officer. And he has been instrumental in leading all of our Essentia efforts from our incident command for COVID planning. And he unfortunately had a conflict today. Otherwise, he would love to be here to join us as well. But as we look at key updates, we thought maybe sharing what's been going on with testing, what's been going on with vaccine. I just wanted to highlight a few of the community collaborations that have been going on throughout this COVID timeframe. And then we thought we'd add a few other updates related to Essentia with Brainerd Lakes really becoming part of the East Market and what that means. And then Vision Northland updates was a question that had been brought up, but certainly any other questions that the group has as we go through this material or at the end, we can do our best to follow up and address those questions. So as we look at the trending, and again, I'm just going to highlight, when I highlight over the slide, are you able to see my cursor or not?
Yes.
So, so testing trends, this is just testing trends here within the Brainerd Lakes area or this region. And going back to early November, you can see it spiked up, and actually going back into October of last fall, we were hitting about 400 tests a day. And that was just for us here at Essentia Health and our testing site at our Kingwood building, about a block away from the hospital. Of course, Cuyuna, Lakewood, Public Health, others were doing testing at the same time. So this is just an indicator of our internal data, and you can see how the testing, daily testing, has now dropped down to many days less than 50 a day. We're probably averaging less than 50 a day right now in terms of people having symptoms or coming in to be tested because of perhaps being exposed to somebody who has been identified as positive. But the trend has really fallen off, and this trend mirrors much of what we're seeing across Essentia. I think our 14-day, I'll go to the next one, which is a 14-day positivity rate, is at around 5% now, meaning over the last 14 days of test results, we've had less than 5% show up as positive. And other sites are down in 1 or 2% area. You see a map kind of sprinkling around different areas. There's a few hot zones still, but really the numbers have really come down substantially. I don't know, Dr. Pryor, if you have any comments about what your observations have been. Have you watched that 14-day?
Yeah, I mean, statewide, we're at 3.6%. So Governor Walz, and I think most experts say you want it to be below 5% in general. So, you know, for a whole bunch of reasons, we still need to keep our guard up. We're not over this yet. And when we talk about the variants, I'll talk more about that. But, you know, 5% is borderline. We do want it to be better than that.
The Minnesota Department of Health also has a website, and I just pulled a couple of these off yesterday just to see where we were at, or actually I pulled it off as of February 19th, I see. But actually the vaccine, as we look at vaccine distribution, you can see the ramp up in terms of number of vaccines administered by week, and it's really ramped up in the month of February. What we've seen across the state of Minnesota is availability of vaccine, and as we collaborated here in the Brainerd Lakes area, we sent out a joint communication with Cuyuna, Lakewood, Crow Wing Public Health, Cass County Public Health, just kind of sharing. We're all in the same situation, whereas as soon as we're able to get vaccine, we're able to administer doses. So, and the goal you'll see on the Minnesota Department of Health is that within 3 days, having 90% of the doses administered, and within 7 days, the goal is to have 100% administered. And our statistics in Crow Wing County, and again, this is not just Essentia Health, this is any doses that are allocated to public health, to the local pharmacies, to the other facilities, including Essentia Health. And you can see overall, we're doing a very good job of getting vaccine doses out. And so again, the overall state trend, we're mirroring that very closely in Crow Wing County. When we look at vaccinations being distributed within Essentia, we also monitor the number of doses. You can see on a daily rate, really got rolling early January, and you can see how that's ramped up. And the complexity in how we manage the doses we have available is we're given the Pfizer vaccine, and the protocol is that second dose should happen within day 20. Day 21 was the target originally. We know that we have a range of roughly between the 21st day and the 42nd day to try to get that second vaccine dose in. Well, as we've ramped up, and I'll just show you the next slide here, which shows the Brainerd Lakes. You can see we've been targeting about 500 a day, but you see gaps here in February, and that's when we did not have vaccine available. So if we have vaccine available, we're administering 500 doses roughly a day at our Brainerd clinic. And again, what we've had to reserve for during this most recent run this last week was trying to get all the second doses in from the folks that we had completed in late January. And so we're hopeful as we get availability of doses that we can also then get into distributing to the higher risk population. Across the state of Minnesota, the guideline has been to, as we get into that first public round of vaccines, that just targeting it at over age 65. And there's all kinds of debates about what the right rules are, but we're bound to follow the rules as all the other health systems in the Minnesota are too, or jeopardizes our ability to continue to receive vaccine to distribute. Dr. Pryor, any observations you would share on the vaccine guidelines that we need to follow?
Yeah, so, well, first of all, Essentia is typically amongst the top 3 institutions in the state for the percentage of the vaccine that it gets into people's arms within the first 3 days. I think it alternates between Alina Children's Hospital and Essentia. It's just, we're very efficient in terms of getting it where it needs to be, which is right in your arm. And the initial guidelines were 1A, which is focused on healthcare workers and people in long-term care facilities. And 1B is people 65 and older. And even though they say we're in 1A, I mean, clearly we're probably the majority of the vaccinations are now going into people 65 and older. And they're also hitting teachers as well. So a lot of you who have teachers in your families, many of them will have been vaccinated or likely will. I think that the medical centers have some discretion in terms of, does it have to be 65 and older or 75 and older? And I know a lot of them are doing 75 and older. So for instance, Fairview in the Twin Cities is not doing between 65 and 74. They're focusing on 75 and older. So, I think it's basically going to be sometime, I think, certainly sometime after April before it really opens up and pretty much anybody can get it. But until then, it's still going to be, we just have limited supply and a big demand. And the beauty of it is that about 90% of all hospitalizations are people 65 and older. So by hitting this group, we really help the terrible strain that this put on our hospitals. And so people still may get it, but the likelihood of it being really severe is much less. I do want to say, however, people die, there's young people who die from this, and there's a terrible condition called multi-system inflammatory syndrome that kids can get as well. So this isn't just because you're younger than 65, this is still something to avoid.
So I just wanted to add another comment. I saw Chris was on, and Chris, I'm hoping that our collaborations with Cuyuna Regional Medical Center and Crow Wing Public Health, at least within Crow Wing County itself, when we're able to get to 1B, we collaborated and tried to make sure that we were reaching out to all the school teachers, all of the group homes, all of the dental offices. And so it was kind of a collaboration to partner up and make sure that we were getting those offerings out to that group that we're qualifying under what the state has defined as the 1B priority group. And I think at this point we've gotten out to most folks and in that category, and that's what's allowed us then to move on to the public and allocating those. But it's been a great collaboration, and I would say even more broadly, Brainerd in St. Joe's is part of the North Central Coalition within the state of Minnesota, which initially was really the body that all the vaccines were allocated to, and then reallocated out within the facilities that are part of the North Central Coalition. And we've collaborated with CentraCare early on in the whole COVID process about bed capacity and coordination of supplies and so forth. In addition to be part of a system like Essentia, it's also been good partnering with the coalition and the facilities within this broader region. Dr. Pryor, you want to comment on the availability of the antibody therapy?
Yeah, so the monoclonal antibody therapy, bamlanivimab, these are basically antibodies that we infuse in somebody, and they go and they neutralize the virus. And so it's meant for people who are not hospitalized, who have recently been diagnosed. I forget the exact time frame. You want to get it, I think, within 7 to 14 days, if I'm not mistaken. I don't remember. Mike, do you know anything different on that? Or maybe you can look that up while I talk about it. But it's very safe. Originally, we were really concerned that the demand for it was going to be really high, and we had limited supplies. So there was a lottery system and things. But interestingly, the demand has not really exceeded the supply. So the purpose of this is to prevent you from getting a severe form of COVID. And so the theory is if you get this, hopefully you will not be hospitalized. We want to keep people out of the hospital. So, and Mike, have you found anything about you have to get it?
Yeah, I don't. I can't click out of my screen here while I'm sharing my screen. But I would just say that it's been very effective for the patients who we have gotten that. So patients that come into our ED that are good candidates, it really has been very effective at helping to stem the symptoms, that there's the onset of symptoms, and really has avoided hospital stays in many cases for those patients. And right now at our St. Joe's Medical Center, we're scheduling patients for this 5 days a week. And again, I think as we want to get the word out for those who have been diagnosed as positive and their symptoms are getting worse, that we want to try to get them into that therapy.
And we probably don't talk about the symptoms enough and how bad this can be. I think we tend to sanitize the whole thing, and that, in retrospect, I think many of us think that may have been a mistake. And it just because it's really, in general, a very terrible disease. I know that there's been a lot of famous people who get it and say, oh, it's no big deal and stuff. But there's a lot of people who get it, and it is just absolutely terrible. It has been described, and you can read about this in the New York Times, as basically slowly drowning over 3 days, or like a prolonged waterboarding. It can be really, really bad. And people who get it and survive it, who get this bad, terrible symptoms and survive it, it's been thought that they suffer from post-traumatic stress syndrome that will last probably for years. So it is not really the best thing to do. Is when you get offered the vaccine, I strongly recommend you take it. Do not hesitate. If you test positive for it and you're all concerned, I would get this monoclonal antibody therapy. It could be life-saving. And again, above all else, I'd continue to, mask up and avoid crowds and just socially distance. So, and then just a little bit on the variant strains. So you've heard about the UK variant strain, B117. It's here in Minnesota. We're still learning about it. There's going to be more genetic variations. It's kind of like the influenza virus. I mean, there's lots of variations that come. Right now, we don't think it's more lethal, this variant, but we do think it's more contagious, close to twice as contagious is the original form of COVID-19. It's about 70% more contagious. So that's what our concern is. So it's kind of like and we do think the vaccine works against it. So it's kind of a race between getting vaccine in people's arms and this B117 variant. And for those of you who are Dr. Osterholm listeners, I personally, I like him and I know him well. We used to give some lectures together and stuff, but he is a little bit of a doom and gloomer, and he thinks there's going to be a terrible, terrible surge thanks to this variant towards the end of March. So he thinks sometime in the next 14 weeks. I don't think the CDC thinks that, but time will tell. But again, I think it really just is another reason why we need to all continue to be careful and again, to mask up and stuff. So basically, in summary, the variants are out there. There'll be more variants. It's more contagious. We don't think it's more lethal, and we do think the vaccine works against it. And we will have Pfizer. These manufacturers, they're going to make boosters for these variants, and they will not have to do as many. It's not going to, first of all, this one did not take very long. This was remarkable how fast these vaccines came out, but the boosters will come out probably even faster. So that's something that we can look forward to. And then you saw previously on this slide about essentia.org, if you've got any questions about the variant. So I see some things in the chat here. Let me see. Yep, we listened to Dr. Osterholm. He is a very smart, I don't want to, he's a very smart guy. I really like him. He's done great things for us. But for those of you who followed him over time, I mean, he is a little bit of a doom and gloomer. It's interesting to be, it'd be interesting to be in his mind all the time. Do we know anything about cover shedding after I'm not sure what cover shedding after the vaccines is. I think
COVID shedding.
Oh, COVID shedding. Yes. We're still learning. So the question is can you spread COVID-19 after you get the vaccine? And I don't think we really know. We don't really know right now. In theory, yes. I mean, you could get it, you can have the virus, it's not affecting you, but you're shedding it and somebody else could get it. And that's another reason why, even after you're vaccinated, why you should wear a mask and why I do when I'm out in public. We just don't know. I would guess, and this is just a guess, I mean, biologically, it makes sense that it's harder for you to pass it on to somebody else. I mean, it's because the viral load is going to be much less. So I would think that it's going to be much more difficult, but possible, but conceivable.
John, are there other known viruses where after you've been vaccinated, you can still pass on the virus?
You know, I honestly don't know, so I'm not going to say.
Okay.
I don't know. I would, you know, the fact that and I've been following this, I've been reading about it, and looking for, you know, because they are studying these people, right? I mean, they're doing viral load tests now. In fact, there was just a study that launched where they're injecting exposing people to small amounts of virus to see when they get symptomatic, young, healthy people. So they're trying to figure out how much virus can you give and how much it takes to get infected. And that may be one reason, by the way. There's multiple reasons why it's a little bit harder to get the virus from kids. One of them, interestingly, is kind of funny, is that they're close to the ground. So kids, when they breathe, the virus is more likely to fall to the ground faster than when you're 6 foot tall. But the other, of course, is that they're smaller bodies and they have less viral load. And the viral load matters. That's why this thing about the 15 minutes, when you're in an enclosed space for 15 minutes, and there's poor circulation, why you're higher risk. It's also why when you're outside and there's wind currents and stuff, it's really hard to get. If you're outside, it's possible to get it from somebody else, but you know, it's tough because the virus is just diffused, you know, by the wind currents and stuff. So I'll go on. Let me just ask any more questions on the virus. There was one, do we know anything about highly compromised immune people and the vaccines? So they're struggling with what is highly immunocompromised. And the definition of that, I know it's hard. And a lot of people could, so people with diabetes, you're immunocompromised, should you get it? There's a lot of people with type 2 diabetes. I'm pretty certain that what they're going to say is people who are actively getting chemotherapy are going to be eligible for it. So I think that that's probably going to be the next one. And do I think that people who are highly immunocompromised, or there's other high risk factors like congestive heart failure and certain pulmonary disease and stuff like that. I do think that people under 65 who have these should get it, but I just don't know. And yeah, and then multiple transplants. And I mean, obviously people who have had a transplant, you know, they're taking immunosuppressive drugs. And so they're by definition immunocompromised. So I think when you have objective criteria like that, getting chemotherapy or on immunocompromised drugs, I'm thinking that that's probably going to be the next phase, but it's just a guess. I mean, I don't know. But I know they talked earlier about it, and I think they from talking to people on the inside about it, they struggled with the definition. Anything else before we move on to other stuff? And we can always come back to this if there's more time. The J&J vaccine, you know, here's what's interesting about the J&J vaccine. So first of all, the storage is better, it's easier, you don't have to have it, you know, minus 36 or whatever it is. So it's not as effective from getting COVID, but the key thing is, to the best of our knowledge, no one's died after they've gotten the J&J from COVID-19. So it prevents deaths. So it's highly effective at preventing deaths. So you may get COVID. As you know, the Moderna is 94% effective. The Pfizer is 95% effective. I forget what the J&J is. I want to say it's like around 80 or so, but it prevents deaths. And at the end of the day, that's really what matters. So it's a good drug. Yeah, and then shingles vaccine is only 90% effective. Yeah. All right. And we can continue. We'll come back to this as you think of other questions. I'd be happy to answer, you know, whatever it is I can. You should know that Brainerd Lakes integration with the East market. So at one point, Brainerd Lakes was its own market. We had a West, a Central, and an East. And the Brainerd Lakes was by far the smallest market. It was 10% of the business at Essentia. and the East was around 70, and the West was, 25% or so. And with COVID, we had obviously a lot of financial issues, and by having duplicative supportive services, it was felt that we should roll in Brainerd Lakes into the East. Also, there's this thinking of one Essentia, which is basically, we're trying to move away from silos and really trying to leverage best practices throughout all of Essentia. And so Brainerd Lakes moved into the East market. And this was a decision made above my pay grade, by the way, and Mike's and Pete Henry's. But that happened right after COVID started, so in April. And to be really transparent and honest, I think it was a little bit hard. Primarily just, the fear of the unknown, and are we losing autonomy, things like that. But as Pete Henry is fond to say, you only lose autonomy when you don't come to the table, when you don't get engaged. And he's been a real star in promoting that. And I'm really all about engagement, and I think a group participating in the thinking is smarter than any one individual. And we have done, I think, really well with the integration in the sense that I feel like there's actually all the resources that were in the East are now coming to bear and bear fruit in the Brainerd Lakes area, including in the recruitment. We've had great success recruiting. Mike, you're going to have to remind me, I think we've got 2 rheumatologists, half-time infectious disease. We brought in support in mental health and psychiatry and psychology. We're building up oncologists here. Who are some of the other great hires that we've had?
We brought in 2 new cardiologists last year. A couple of things as part of the East and really Essentia structure, looking at service lines. There's been a kind of a commitment to how do we grow particular service lines, and specifically cardiovascular services. We've kind of been at a plateau, but to really raise our scope of cardiology that we can offer 24/7 in the Brainerd Lakes area. We want to get that jump started and add additional physicians to that mix. Same thing with our cancer center and oncology. As we work with oncology and cancer leaders within the East market, they're really committed to seeing this as a regional hub in Brainerd at St. Joe's, and really kind of being able to support the broader region with more oncologists in this area. Endocrine was another area where we've really struggled. In the rheumatology, I'll be honest, we've been recruiting since I've been here, and it's a very, very tough specialty to land, and there's a high demand for rheumatology services in the region. So having 2 join us this summer will be really filling a market need here in this broader community. So it's been very positive from that standpoint.
I think this is a good lead into the Vision Northland, in the sense that, so we're building this $900 million hospital right there. For those of you, it starts on Superior Street, 4th Avenue, and goes up to 2nd Street, overlooking the lake. It's 942,000 square feet. It's 5,600 on-site construction jobs and 3,600 off-site construction related jobs. So it's really good for the economy of Duluth. And it hires the goal is 8% minority or female construction workers, and it double that at 16%. The goal is to really get us into the next healthcare for the next 50 years. I mean, we were in an extremely dated building with hardly any private rooms. And if you walk in the ICU there, it's been really busy lately, obviously, as you can imagine, with COVID and stuff. It is just cramped, and it's just hard to deliver the care that we think needs to be delivered. It's not efficient, and it's just really not good for staff or for the patients. So we think this is going to enhance the patient staff experience, allow us to recruit top talent, and like I said, really kind of get us into the get us into the next 50 years. So we started in September of 19. We'll finish a steel, I think, this summer. They're done with the South Tower, which is a clinic tower, and they're working on the North Tower, and it goes up 18, it's actually 17 floors. It's 8, there'll be an 18th floor, but we don't name the 13th because nobody wants to be on floor 13. So, and then there'll, the building will be enclosed in early 2022, completely enclosed, and the construction is going to be complete sometime either at the end of 2022 or first quarter 2023. But then it takes us about 6 months to get ready for the big move, and we're going to move over basically a weekend. So that's going to be quite remarkable. And right now we're putting on the South Tower, you'll see that we're starting to put glass in, and it's a fritted glass, so birds tend to see it. So they won't, hopefully, I mean, the goal is not to kill any birds for the bird lovers amongst us, myself included. So I think one of the things that, you know, we are a level 1 trauma center there in Duluth. So we see terrible trauma we take care of it there, and we tend to have tertiary and quaternary services. So we do things like a lot of the more advanced cancers and a lot of the more advanced heart and vascular things. But our goal, just so that you know, our goal is to treat people locally whenever possible. And we want to treat the right patient at the right place at the right time. And to me, that means you treat people locally. Obviously you don't if you don't have the services there, but people want to be by their home. They want to be by their family. So the purpose of putting this up is not to send patients to Duluth. It's actually the opposite. We want to keep people locally. And with our telehealth services, we're able to do that even now more than ever. So here at St. Joseph's, for instance, we have one really great intensivist, Dr. Davis, Greg Davis. So he's specialized, he's a pulmonologist who specializes in intensive care. He can't work 24/7. And sometimes he needs to take vacation. And, you know, the poor guys, I mean, it's just amazing what he does. But the way we get by with that is we've got tele-ICU. So we've got people in Duluth who basically can care for their patients at a distance and stuff. And that's kind of how you use the power of the system. And we take care of each other so that you get great high quality care no matter where you are in the system. And that's the whole purpose of kind of what we're about and what we want to do. I'll just finish with Crow Wing Energize because I know we're coming up to the top of the hour, but then open up for any questions. Crow Wing Energize is a great group. I have been going to their executive steering committee sessions once a month, and they're about getting upstream in terms of health issues like mental health and eating healthy and things like that, anti-smoking. And so they have been so beneficial for Crow Wing County. I mean, Mike, we've gone from what to what in terms of our health?
Well, in terms of overall county health ranking, I think we went from in the mid 60s, there are 86 counties in the state of Minnesota. We were around mid 60s, 65, 66, somewhere in there 2 years ago, and we're down to 40th now. So really demonstrated year-over-year improvement over the last 3 or 4 years now with Crow Wing Energize. I want to again say Crow Wing Energize is a partnership between Essentia Health and Crow Wing County Public Health, and really partnering with the broader community at large to try to help address the common community health needs of the whole region. So very positive collaboration there.
And people in this, they're so enthused about health. I mean, it's contagious in a good way. And so they're having an 8th annual virtual summit on Friday, March 5th. I think it's from 8:30 to 9, they've got coffee hour, and you could talk about COVID and meet some of the people of Crow Wing and some essential leaders. And then from 9 to 11 is the program, and Dr. Negri, Nanette Negri is going to be talking. It's called Watering the Seeds of Well-Being Through Mindfulness and Meditation. And so you can enhance well-being in your life and learn about meditation and mindfulness. Wear comfortable clothing, but I think these are great things to learn. especially for me. I try meditation. I still work at that. I'm not very good at it. But mindfulness has been especially during COVID, has been really helpful for me to kind of focus on the moment, not get too worried about the future. And it's been really great.
Gentlemen, I'm going to bring the bell and dismiss. And if there's more questions, we can continue after the bell for those that don't have to run. Stand by. Go forth and serve.
So one quick comment on Growing Energized. I remember when it was first starting, and one of the great benefits for those of us who are fiscal conservatives, the relationship between county health and Essentia, it became a great partnership, and it was significantly reducing the cost of public health because they were able to work with each other to collaborate. And I think that's one of the unspoken benefits that have come from this as a taxpayer. But it's also developed into just an outstanding culture of healthiness in our region. And our region was not famous for that prior to Growing Energized. So kudos for keeping it going.
Said that very well. So much better it's so much more cost effective to get upstream to these things and keep people healthy than treat them when they're not healthy.
Yeah. There were so many people that were using ER as their primary care, and we needed to get away from that. And so that relationship, I think, was significant and made a major change in the quality of life for a lot of people who otherwise couldn't afford healthcare.
Yeah.
I did share the Growing Energized flyer with Harlan, and Harlan, if you can help us get that distributed out to your membership, that'd be great. Again, it's a free event. And the other thing is there's a coffee chat from 8:30 to 9, and then the annual summit's from 9 to 11. The coffee chat is going to be a collaboration of a panel of Dr. Peter Henry, Kyle Bauer from Kiona Regional, and Tim Rice, who's the president at Lakewood Health, and as well as Tim Hool, our Crow Wing County administrator. And so they're going to try to help address any questions the group has with a COVID focus on that before we jump into the regular 2-hour session for the summit.
I see one question here. Why did the experts decide to go with the vaccine that needed the lower temperature than the other one? It's because it was out first. I mean, there was just, the demand was so high. The need was so great. They just wanted it. The first vaccine to get out, they wanted to get it in the arms of people. That's the reason why. Any other questions? If not, thanks for all you do.
Great to see you again.
So great to see you. Thanks for inviting us.
And I'll just say thank you to Essentia as one of the 65 and older crowd. My husband and I have both had both vaccines as of last Wednesday. Your organization was unbelievable. It was a pain. We were fortunate, no reactions whatsoever, not even a sore arm. We couldn't believe the nurse had truly given us the shot. So it was really well done.
And do you feel, a lot of people say they just feel different when they get it, better.
We're talking about still being safe and wearing our masks and all that, but we're talking about driving down to see our grandkids in a month. So, you know,
Great.
We do feel different. There's a sense of peace. You know, we know from everything they're seeing, it's 100% effective against death, and it's pretty darn effective against even ending up in the hospital. So we feel good.
It was wonderfully seamless. I think the only thing missing after the 15-minute wait, it seemed as jubilant as people were, there should have been either cake or champagne. Everyone felt just very, very happy to get their shots.
I'll pass that on, Bob.
Please do.
Thanks, everybody.
Thank you.
Thank you.
Bye-bye.
So those who are staying on for the grant discussion, Pete, and we have a local grant that we need to submit something for, and we just need to talk about what we still need to pull together for that. So I know Pete and Steve and Stephen and Simon are planning on staying on.
What grant is that, Patty?
It's for the Brainerd Lakes Area Community Foundation. They actually have a grant out that local nonprofits can apply for in relation to how you helped respond to the COVID crisis. So,
And Patty, I do have a new grant request, and we'll go over that when I get it, but it's going to be tied to the REAP Festival. So
okay, so when yeah, let's not talk about that today then, Steve. Let's talk about.
I have to get it on board today.
Okay, well, Diane's not back. She'll be back next week. What's the deadline for that one?
What's the deadline for district grants?
March 31st, isn't it?
Yeah, for the current round, yes.
Okay, we want to be in on that one.
The observation, and Dan, feel free to share your perspective, but it's the district is pretty well tapped out for this year. So
yeah. See, I'm just in the process of mentoring